Hi everyone, it's Mark Poloncarz. I'm in my office giving this Facebook Live update in which you can ask questions. Of course, if you're seeing this live, you know you are watching it through my County Executive Facebook page. If you want to share it with folks, share it so others are available. I'm here with Derek Smith from my office. Derek's been manning the social media and helping out the Erie County Department of Health social media aspect as we're getting information out to the public on the COVID-19 crisis, the growing, unfortunately, threat to our community and our country. But I'm here to talk a little bit about some of the issues that we're dealing with. Derek's going to read the questions as they come along. So if you have questions, we might not be able to get to all of them, but we're going to try to get to as many of them as we can. I just want to remind everybody that we're in this together. We want to show solidarity with our brothers and sisters in the neighborhood, in our country. And if we do that, we will get through this, and that means following the rules and regulations that are in place. I hope that people understand that this is going to be some time before we're back to some normalcy. I'm hopeful that we get through this as quickly as possible, but of course, I can't give any assurances at this point that this is going to end in a week, 2 weeks, or for that matter, 2 months. So let's do what we can to ensure that we're protecting our fellow neighbors, our family members, the people of this community, and in the end, the people of the world by getting through this global pandemic. I want to show everyone, because there's been a lot of questions with regards to some item I brought up at my press conference earlier today, which is the 50% rule with regards to businesses and their occupancy. This is the executive order that was signed by, not me, but Governor Andrew Cuomo on March 12th. And it applies to many different things associated with the state of emergency in the state of New York. So the thing I'm going to talk about is not an emergency order that was issued by me. It was an emergency order issued by Governor Andrew Cuomo on March 12th. And the relevant provisions with regards to businesses, and I will read it in full, is any place of business or public accommodation, comma, and any gathering or event for which attendance is anticipated to be fewer than 500 people, comma, shall operate at no greater than 50% occupancy, comma, and no greater than 50% of seating capacity, comma, for 30 days effective on Friday, March 13th, 2020, except that any theater seating 500 or more attendees for a live performance located in a city of 1 million or more shall not hold any performances after 5 p.m. on March 12th, 2020. There is an exemption. The preceding directive shall not apply to a school, hospital, nursing home, other medical office or facility as determined by the Commissioner of Health, mass transit or mass transit facility, governmental facility, law enforcement facility, or retail establishments including grocery stores, period. The Commissioner of Health may allow for businesses that are not public gathering spaces to exceed 500 persons if the occupancy is less than 50% capacity, subject to public health review. And there's the seal of the state of New York, signed by Governor Andrew M. Cuomo. So what I want folks to understand, including all the businesses out there, is that you have to be at 50% of occupancy. You should send as many employees as you can home. Have them work at home. But you are not allowed to be above 50% occupancy, and it really doesn't matter what size business you are. If you are a very large business like General Motors or Geico and you have an occupancy of 1,000, you cannot be at 1,000. You have to be at 50%. If you have an occupancy of 400, you cannot be at 400. You have to be at 200. And it goes all the way down to the smallest one. So we want our local business community to know that this order, which came from Governor Andrew Cuomo on March 12th and became effective on the 13th, is in effect today. This is the order here. It was not signed by me. We are relaying the information we received from New York State. There was a lot of confusion about it, and we were getting a lot of questions about it, so we brought it up at the press conference earlier today, and we also decided it was important that people see the actual order. The highlighted areas are in yellow. It's the last thing with the seal and then the signature of the governor, so people understand that this is a real order in New York State right now.
It is posted on our website.
And it is posted on our website, as Derek notifies and has just informed me. So I don't know if there's any questions, Derek. We're coming actually from my office. This is my office space. If you haven't seen it, never been in it, we've certainly invited people before. but we want you to ask your questions, and hopefully I'll be able to answer them. So, Derek, what do we got?
Yeah, so we'll start with an easy one. This is one that we've gotten a lot. What if I don't have a personal care provider, but I'm feeling symptoms of a cold?
Well, if you do not have a healthcare provider, and we certainly hope that everyone will get a healthcare provider, if you have symptoms such as a fever or issues associated with respiratory matters and a cough, you should call our phone number at 858-2929. That is our COVID-19 helpline. Someone will then try to direct your, if they can answer it immediately, they will answer it immediately. Otherwise, they will direct it to our public health professionals to determine if you are an individual who needs to be tested for COVID-19. We think it's important that everyone understand that we want individuals who are sick to stay home. You may not have COVID-19. You could just have the flu. You could just have a cough. Unfortunately, a lot of the symptoms are the same. But if you have a healthcare provider and you're not feeling well, call your healthcare provider. Whatever you do, even if you don't have a healthcare provider, do not go to the emergency room. Do not go to urgent care. If you do not have a healthcare provider, call us at 858-2929 between 9 a.m. and 9 p.m. Monday through Friday, and we will have someone, if they could not answer the call directly on that phone, they will have someone from our public health office call you back later.
So here's, we'll combine a couple questions so we can just sort of illustrate the difference between the business regulations that were issued by New York State. So someone had a question about car dealerships. They work in a car dealership. And then someone else had a question about they work in Wegmans, and still they want to know what they should do if they work in Wegmans. There's a lot of people in there. There's obviously a lot of people buying things. And maybe also you can touch on some of the panic buying.
Well, when it comes to grocery stores like Wegmans, they are exempt. There's an exemption, as I said. It does the rules that have been put in place, such as the 50% capacity, does not apply to a school, hospital, nursing home, medical office or facility, mass transit facility, governmental facility, even though the governor has now issued that we be at 50% capacity, law enforcement facility, or retail establishments, including grocery stores. So it would not apply to a Wegmans, but it would apply to a car dealership. So if a car dealership is currently in operation and it has an occupancy of, let's say, 125 people in the building, and there's 125 people in the building, you can't have 125 people in the building. You're going to have to go down to 62. You're going to have to go down to 50% occupancy.
And then why don't you touch a little bit on the buying? People are worried that too many people are buying things at the stores, they're getting empty, and they're worried there may not be enough supplies.
We have been in contact through our Department of Homeland Security and Emergency Services coordinators with the various emergency managers of the major retail chains. Did you know that the major retail chains like Wegmans, Tops, Price Rate, all these have an emergency manager? They do. And that's because there are situations when there are going to be issues with regards to, will we have a supply chain of food coming into a community to address the issues we have? Our Department of Homeland Security and Emergency Services have been in touch with the emergency managers of these major organizations, and we have been continually informed that there are no supply chain issues. They have no problem getting food in. The problem is people are hoarding in the purchases that they're making. So they're buying toilet paper. When I say they, I'm talking about the grocery stores, the retail establishments like a Target, that actually in Walmart that have a grocery function as well. They are getting supplies in. They're replenishing their stock. The issue is people are hoarding it. And we're just asking people to act appropriately. There are no issues with supply chain. Manufacturers are producing the goods. They are being sent out. And I want people to understand that when you have a respiratory issue, and that's what COVID-19 is, there's no reason to have 4 months worth of toilet paper. We think it's appropriate that people buy what they need for the immediate future, but not buy what they need for the next 4 months. So we want people to act appropriately, because when you buy it all, you're prohibiting another member of your community from buying it that may need it. We heard repeated stories of people buying baby wipes who have no kids, no reason for baby wipes. And then the families would go in and try to buy baby wipes, and they were off the shelf. So we want people to buy what is responsible for their needs, and know that if you have to go shopping next week, it will still be on the shelf because the supply chain is not being used up.
All right, so I must admit we are having some technical difficulties, but
Okay?
But we've been getting a lot of similar questions. Daycare, childcare. I think that'd be something that they'd want to hear from.
Childcare is certainly a concern. There are a number of childcare facilities that actually have closed locally. We know that many people are in need of childcare that normally wouldn't need it because their children are in school during the workday hours. Our emergency services department has been working with two people in particular, the commissioner of the Department of Social Services, Marie Cannon, and my deputy county executive, Maria White, in a task force with other partners from across our community to come up with ways to provide childcare for emergency responders, first responders, people in the healthcare industry such as hospitals, urgent care, doctors' offices, as well as local governments, so that we can provide childcare for our employees, for the people that are most at need. A lot of people are going to be home over the next few weeks with their children. I know everyone's going to get a little crazed at home. They're going to get a little cabin fever. But we want people to understand you can go outside, you can go for a walk, you can take your kids, throw the ball around in the yard. It's getting warmer out, so it's not like it was during the winter. But if you need childcare because you work in one of the essential fields, we are doing our best to open up new childcare facilities that will only be available for those that need it because they're emergency personnel, essential personnel with hospitals and the like. It may take us a little bit more time to open up those, but we're working with New York State to come up with the guidelines to open them. We may be opening them in places we never have. We've had some offers from towns to open them in senior centers. So the senior centers are closed, but they may be turned into child care facilities during the weekdays so individuals can go to work during this crisis.
All right, so this is a common question that we've gotten. When we post the locations of the folks, the infected folks, the identified, and people say, well, I was at that Wegmans that day, or I was at that mall that day. What should they do? What should they do from there if they were at that location but they're not showing symptoms?
If you were at one of the locations that we identified, whether it was the Galleria Mall that day, a couple of the recent stores we talked about, the Lexington Food Co-op on Elmwood Avenue, 7-Eleven on Elmwood Avenue across from the Lexington Food Co-op, the Harlem Road Community Center is identified during those particular times, or a library, you need to monitor your health conditions. There is a 14-day basic incubation period. So if you were there on that particular date and that individual was symptomatic, they could have passed the illness, but it's possible they could have passed it even if they weren't showing symptoms. So you basically have to look at 14 days from that period where you monitor your health. We want people to understand that if you start showing signs of what would be the COVID-19, such as fever, respiratory illness, cough, you need to call your healthcare provider immediately. You are not in mandatory quarantine. A lot of people are wondering, do I have to quarantine myself? You could quarantine yourself, but the most important thing you need to do is monitor your health symptoms.
Mental health. People are very anxious right now. They're uncertain. Like you mentioned, cabin fever. What are some maybe good mental health resources, things people can do, resources that we have that are available to them?
Well, we do have a mental health department, but that primarily works with providers to provide services to the greater community. We ask that if you do have serious issues and you're very concerned, if you're exceptionally stressed out, you're worried about what you're doing right now, you could call Crisis Services. Crisis Services hotline is open 24 hours daily. I'm trying to remember off the top of my head, and I think I know what it is, but I don't want to say it if it's wrong. We'll actually have Derek put it online if we can find it.
Yes, I will post it.
But there's a lot of resources out there. You can find them on the internet. That people are in organizations that are out there to help individuals in a crisis situation. We're telling folks it is okay to go out, but we're trying to limit the contact between individuals. So if you need to go for a walk, go for a walk. If you've got people in your house that you're living with, okay, it's okay for you guys to go out, but we wouldn't necessarily recommend you join others at the same time. We want you to realize that cabin fever is going to definitely set in. It has for some people already. And we want everyone to basically go under the assumption that while we're trying to avoid community spread, that means you don't have to be locked in your house at this period. You can get out as necessary. And if you are feeling stressed, talk to a friend, talk to a family member. If you have to, call Crisis Services. They'll be glad to give you the resources that are available. We just want people to understand that we're all in this together, which means it's going to be tough times for a while, but we can do it together if we work together as a community to help each other out. Oh, asked to move the microphone a little closer. We can do that. So hopefully that's a little better, a little louder. I do not have, unfortunately, an individual with us from Deaf Access Services to provide sign language for this. Unfortunately, we can only get them for the press conferences. A lot of people wonder, do I actually have somebody on my staff who is trained in sign language? And the answer is actually no. We don't have an individual on Erie County staff whose sole job is to provide sign language services for our events. We get them from Deaf Access Services. I want to thank those individuals. Karen and Kendra were at our press conference earlier today. We will have them as much as we can for every press conference. This Facebook Live was put together real quick because we know there's a lot of questions that people are having, and we just wanted to have an opportunity for me to talk with you, the people of Erie County and Western New York. And I'm sorry, though, we were not able to bring someone from Deaf Access Services at this point.
One quick one, blood donations. You mentioned in the press conference how important that is. Maybe let them know about the Red Cross, Connect Life.
We are very concerned because the local blood bank is down to 5 days. And we know there's a lot of people out there who donate blood all the time, but they're a little afraid to do it now. If you're healthy, if you're not showing symptoms, you can donate blood. You can contact the Red Cross, contact Connect Life. Both of those organizations are one of the primary recipients and those who take blood from donors. It is important that we have the blood supply on hand. Even if elective surgeries have been terminated at hospitals, there are still some elective surgeries going on in doctors' offices, but more importantly, we're going to need it for emergency situations, emergency surgeries. If someone's in an automobile accident, you certainly don't want to have to go to the hospital and then find out that they have a limited supply of blood in case that people need transfusions. So if you or a loved one are blood donors, go out there and donate some blood. It'll make a big difference in somebody's life and could potentially save them. Anything else? I'm sure we got lots.
Yeah, we do have tons. Maybe just finally touch on social services and remind the folks of our hotline number because that's going to be very important.
We've got a lot going on in county government right now. Even the departments that are technically non-essential, some of those personnel are being moved to essential positions elsewhere. And one of the biggest things that we have are needs with regards to the Department of Social Services. There are still emergency services that are being utilized in Erie County government. Our offices are open even if they're on a skeletal staff in some areas or their staff has been reduced. We have reduced our staff by 50% on a daily basis. Some people are working from home. But there are individuals who still need help from our Department of Social Services. And there are, of course, people who have lots of questions with regards to the coronavirus and COVID-19. That's why we created the hotline at 858-2929 to call for coronavirus and COVID-19 issues. If you have questions with regards to departmental matters, you can go to our website at erie.gov and just pull down the phone numbers for the departments. Even though some of the departments are running on a skeletal staff, we will try to get back with you. The major departments are all operating. Some of the smaller ones like EEO, we're basically taking those individuals and put them off, or Commission on the Status of Women. Some of the smaller ones, as I say, we've had to reduce the staff, but larger ones are in effect. We have people who are there to help you answer your calls. If you have questions, check our website for the phone numbers for all of the departments. Of course, you can call my office at 858-5000 with general questions. We will try to respond to them as many as possible. If you have a specific question regarding COVID-19, please don't call my office. Call the hotline at 858-2929. The individuals down there are handling calls. If they can answer them immediately, such as answer your question immediately, they will. If they can't, they will give it to one of the individuals associated with the Erie County Department of Health, and they will then get back with you. We want accurate information out to the public. We don't want people to have incorrect information. And I really appreciate everyone's sincerity and understanding what we're dealing with. We are going to get through this together. Utilize your local restaurants, those that unfortunately had to close but still may be open for takeout or delivery. Call them. Help keep them alive. We don't want to see a lot of our businesses go under because of this. Help put money back into our local economy. President talked today about a stimulus package to get additional resources and dollars into our pockets. That's a great thing, but the money's not going to come right away. So if you're unemployed, you do and can apply for unemployment insurance with New York State. Check out the New York State Department of Labor's website, and you can apply online. You don't have to do it in person if you are unemployed. If you are employed, remember, your business has to follow the 50% occupancy rule that was set by Governor Cuomo on March 12th And it applies to every business except the following: schools, which are basically shut down anyway, hospitals, nursing homes, other medical office or facility, other medical office or facility as determined by the Commissioner of Health, mass transit or mass transit facility, governmental facility, law enforcement facility, or retail establishments, including grocery stores. So if it's a grocery store or retail establishment, they can still be open for the time being. If you're not one of those exemptions, you got to be at 50% occupancy. We're serious. If we're going to stop the spread of COVID-19 throughout our entire community, we have to reduce the amount of people that are out there in the workforce. You can still work at home. An employer, if they can put their people at home, shut down your offices and work at home if you can do that. And there's many that can do that. Not everyone can. But we expect and hope that everyone follows the law so less people will become infected. If you're feeling ill, if you're feeling sick, you're sick. Stay home. Don't go to work, no matter what. Don't go to work. Call your doctor. Call your personal health care provider. If you don't have a personal health care provider, you can call us at 858-2929. We'll try to get back with you if you're sick to determine if you are someone who should be tested for COVID-19. We're going to do this as much as we can, hopefully on a daily basis, maybe not on a daily basis, depending on how the situation is. But we'll try to do it on a daily basis so everyone has an opportunity to communicate with me. I'll try to answer your questions. And just to remind everybody, these are uncharted waters. This is not a time that any of us have ever seen in our lifetime. I hearken back to what my grandfather told me about during World War II, in which our country came together. There was rationing of sugar. There was rationing of gasoline. Men went overseas to fight for our country. Many of them did not return, but we were in it together and we won that battle. This is a different battle, but we need to be together to get through it. I've said it before, we are hopefully all in solidarity. If you got a U.S. flag, put it out on your porch. If you don't have one, put one in your window to show your fellow neighbors that we are all in this together. Please share that message. It's just a way of saying to everyone, I'm united with my neighbor to get through the coronavirus, COVID-19. It may seem a little goofy, but there's nothing wrong to say we're proud Americans standing for each other, in solidarity with each other so that we can get through this virus.
We're going to have one more quick question, and this is important for the public. Is the Rath Building still open to the public?
Good question. Is the Rath Building still open? Yes, it is, but for limited purposes and services, primarily for the Department of Social Service and our staff that needs to be here. There's very few services that actually the public needs to come to for the Rath Building. There are a few, but very few. And we want the public to understand if you're an individual who has to apply for emergency aid, you can do it online, but if you don't have the ability to do it online, and if you're watching here, you probably could, but some people don't, especially now that the libraries are closed. Our Department of Social Services at the entrance on Pearl Street is open for services. And we want people to understand that. The clerk's office is open for services. They're also at a 50% capacity, and they were not taking any services from people from outside Erie County. But there are services available here. We're going to try to keep them open as long as we can. We know there's a lot of people who are questioning why. Well, government has to run. Our community has to run. I hope we don't get to a point where we've shut down the entire community, because if that's the case, it's gotten much worse, folks. Let's do what we think is appropriate to protect our families, to protect our neighbors, but let's also ensure that if you need to get emergency services from the Department of Social Services, they're available for the family as well. A lot of the things can be done online. If you have the ability to do it online, do it online. If not, call our numbers for each of the departments to determine that the service that you need is, number one, open, and number two, if it is, can it be done online? If it can be done online, please do it online. If not, call them to schedule an appointment from when you can come in. And with that, I just want to wish everyone a great day. I know it's St. Patrick's Day. It's different than any St. Patrick's Day we've ever had before. We will get through this together if we work together and to ensure that we are doing what is the right thing for Erie County and Western New York. And with that, I just hope everyone has as good a day as possible, and we'll talk to you soon. Take care.